everyone. Thanks so much for tuning in to our second segment of Wellness Wednesday, brought to you by Norterra Family Medicine. I'm going to start by just introducing myself. I'm Dr. Christine Sarna, and I am co-owner of Norterra Family Medicine. We opened about 14 years ago. My background is integrative family medicine, and my passion is bioidentical hormones, which is going to be our topic for today. And this is Nicole Walker.
Hello.
Tell us about you.
So I am a physician assistant here at Norterra. I've been with the practice for a little over 9 years now. I've been in the Valley for a long time practicing, definitely family practice background, but I've learned a lot about bioidentical hormones since I've been here at Norterra. It's one of the things I enjoy doing with patients also. A little extra background I have is I do have some sports medicine training previously, and so I am able to bring that into this practice and see patients for those types of injuries and things too.
Which has been awesome. You'll notice that each one of the providers has a little niche that they love to do, and so that's really exciting for our patients because we have a huge variety of expertise. So, as I said, today's segment is going to be on bioidentical hormone therapy. So, Nicole, tell our viewers, what does bioidentical mean?
So bioidentical means that the hormones we use are plant-based. They come from plants, natural. They are used to create the hormones, and the structure chemically of these hormones that you take are identical to the hormones that you make in your own body.
That's awesome. And how do they differ from other hormones that are out there?
The other hormones are kind of imitations. They're synthetically made, in laboratories, and they mimic the hormones. They're not the same as what you have produced in your body on your own.
And I'll tell you why that's important. So when you are using the exact bioidentical hormone, your hormone is going to fit into the receptor in your body like a key fits into a lock, and you will get the exact perfect message provided and the outcome that you predicted. That's different from synthetic hormones that are the lookalikes because they don't fit lock and key. So although you may be able to turn on a signal, the outcome you get may be different. And it's super important because everybody is worried about hormones causing cancer, causing blood clots, causing heart disease. And when you use bioidentical hormones, you actually get the opposite. Just think about it. So we don't have dementia, heart disease, blood clots, even cancers in our 20, 30, and not very often 40-year-olds, because guess what? They have their hormones. Their hormones are protective. So as we age, those hormones drop out, we lose that protection. And so when we replenish those hormones with bioidentical, then we're actually only helping prevent those chronic diseases.
Yeah.
When we use the lookalikes, we can get some not so good side effects.
Yes.
So why do people want to replace their hormones? Like, what are they coming into you with complaints of?
There is a wide range of symptoms that a patient might tell me about that really makes me think, hey, we should look at the hormones. Yes, there's the typical for women, hot flashes, night sweats, maybe some dry skin, things like that. But there's so many other pieces to it. Changes in mood, anxieties, how you handle stress could be impacted. Brain, what I call brain fogginess, or just feeling like your brain's just not quite what it used to be. Energy, motivation, there's so many pieces to it. And so there's many symptoms that would draw us in to look at the hormones.
And this can be in men and women. So we always think about the women because the hot flash is such a classic symptom. But men will present with brain fog, anxiety, they can't sleep, their heart is racing. They also may say that, they go to work and all they can do when they get home is just drop on the couch and fall asleep. Or they might do a workout, but it takes them a week to recover. These are all symptoms of low hormones.
Yes.
And we can fix that, which is so exciting. So, Nicole, tell our viewers what different options are available with bioidentical hormones.
Well, there's a few things that we can do. So here through Norterra, we do have compounded hormones. So you would go through what we call a compounding pharmacy, and you would have a prescription that's transdermal, I guess is the term we would use. We're not going to have you swallowing most of your hormones when we give it to you. That's part of that kind of natural way to take them. It might be in the form of something that's like a topical cream, or almost like a lotion that you would put maybe on your skin or some other areas. There's what's called a troche or a lozenge. So that's a piece that's formed to put in your mouth, but it's not meant to swallow. It's meant to be under your tongue or in the gum tissue, so it can dissolve and absorb into that area. So then it's going through those kind of tissue barriers that way. And a very unique, different way that we can offer that Dr. Sarna does through the Paradise Med Spa right next door is BioT pelleting. So it's hormone pelleting. So I don't know if you want to talk a little bit more about that.
Yeah. So the BioT pellets have some major advantages. So this is powdered bioidentical hormone. This powder is compressed into the shape of small pellets, and those pellets are implanted in a little bit of fat, usually above your butt. While they're sitting there, capillaries will grow right around where they are, and every single heartbeat, you are pulling hormone into the bloodstream 24/7. And so it's extremely efficient delivery. It cannot fail. Yeah. And for men and women, it can last anywhere between 4 to 6 months. And so that's why we really love that option. The reason why we do it next door, not here, is it's not an insurance covered option. And so that's why we just keep everything that's cash only at that practice. But it is a really great option for hormone replacement therapy. The other options though are good as well, absorbing through the skin and absorbing into the bloodstream through the mouth. One other thing, pardon me, is a cream that you put vaginally, usually in between the labia, because that also uses your mucous membranes to absorb. So there's all different ways that people use their hormones. And our protocol, if you will, is we will get some baseline hormone levels. Then we'll come up with a plan of how we're going to replenish them. Then we're going to repeat those hormone levels, and we're going to identify if the levels are optimal and if your symptoms are better. And if they are, then we move forward with that. And we continually monitor these things over time as well.
It's very unique. Each person, the plan that we have and the form we're going to use is going to vary. So each prescription and each patient we're working with, it's very individualized.
And that's super important because it's never going to be a one-size-fits-all type of situation. And we also are going to, make sure that you're up to date with all your cancer screenings. And really, when we're looking at balance and hormones, yes, we want to replace the missing ones, but we also just need all balance, right? You have to have a good state of health. You have to have a healthy diet. You need to be exercising. You need to be sleeping at night. You need to be handling your stress well. All of these things will bring you to the best state of wellness. So I'm going to say, if anyone has any questions about bioidentical hormones, please feel free to make an appointment with one of us. Myself, Nicole, and even Molly and Alan, all of us will specialize in hormone therapy. If you have any of those symptoms and just wonder, could that be my hormones? Then we can help facilitate a blood test and interpretation and then come up with a plan. Do you have anything to add?
No, don't be shy. Schedule for it. You can learn a lot about yourself and really optimize how you feel.
All right. Well, thanks so much for tuning in, everybody. Have a great rest of your day.
Bye.